Hello, everyone, and welcome to another lunchtime webinar on nutritional and lifestyle medicine. This topic today is a very niche topic on the management of premenstrual syndrome. It's not like everybody has this problem, but I think it's an important one for us to look at. So I thank you for joining today. So we only have an hour, so let's dig right into it. So just to remind you what happens in a normal menstrual cycle. At the end of a menstrual cycle, after menstruation, estrogen and progesterone levels are very low. So the hypothalamus is sending signals to the pituitary gland to start a new menstrual cycle the next month. So the first thing that happens is you're getting an increased risk of follicle stimulating hormone. That helps the immature follicles in the ovaries start to mature and develop, but eventually one will outpace the rest. And then, of course, luteinizing hormone will then kick in towards the second part of the cycle here around ovulation. But as the follicle is developing in the ovary, it's secreting estrogen. And the more it matures, the more estrogen it secretes. So in the first part of the menstrual cycle, estrogen is the dominant hormone. And then after ovulation, the follicle that's still rolling down through the fallopian tube is still secreting some estrogen. But after ovulation, the part that's left behind in the ovaries, remember, is the corpus luteum, and that starts to secrete progesterone. So in the second half of the menstrual cycle, progesterone is the dominant hormone. And this really is where the problem is for women that have PMS, is that the progesterone to estrogen ratio towards the end of the menstrual cycle becomes imbalanced. There's usually too much estrogen and not enough progesterone. I'll show you the reasons why that happens and what you can do to help women correct that problem and sort of get to the root cause. And so that's sort of the overall story. And then if you put all those hormones together on one graph, you see follicle stimulating hormone initiating the menstrual cycle, and then estrogen being the dominant hormone before ovulation. And then after ovulation, estrogen levels would be lower because progesterone levels are rising because the corpus luteum now is secreting a fair bit of progesterone. If the egg doesn't get fertilized within a timely fashion, then it runs out of steam, it undergoes involution, it stops secreting estrogen, the corpus luteum undergoes involution back in the ovary. Now estrogen levels and progesterone levels drop down, and so you have menstruation, and then another cycle begins the next month. That's what's supposed to happen. So in premenstrual syndrome, it's a recurrent sort of cluster of different types of troublesome physical and emotional symptoms that occur after ovulation, sort of the 7 to 14 days leading up to menstruation. About a third of women are affected between age 25 and 40, and up to 10% of women have very, very severe symptoms. And for these women, they're looking for solutions, and hopefully you can help them with this. Some studies have shown that 90% of women have experienced some PMS at some point in their reproductive years, and 5 to 8% have very severe symptoms. So it's somewhere between probably 8 and 10% of women that are having very severe symptoms with PMS. And so what are the symptoms? Well, they can be sort of behavioral or sort of neurologically based, with nervousness, anxiety, irritability, of course, mood swings, fatigue, lethargy, feelings of depression, not uncommon. And then gastrointestinal with bloating and diarrhea or constipation, appetite changes, cravings for foods you normally wouldn't be craving, salt and chocolate, sugar. And then reproductive tissue, sort of breast tenderness and swelling, uterine cramps like dysmenorrhea that can be very severe. Some women just have to take a few days off of work every month because their cramps are so severe. Changes in libido. And then other things like headaches and back pain, as chiropractors know, because they can be help to treat some of that and the dysmenorrhea. And then if testosterone is the dominant hormone now, then acne becomes a factor. And then you get swelling because aldosterone levels also increase, as you're going to see. So women experiencing PMS, normally a single woman isn't getting all of these symptoms, but she's getting usually some combination of these things that sort of defines her particular experience. So the medical view is like, okay, this is sort of an imbalance between sort of steroidal hormones and things going on with neurotransmitters. So we can solve this problem by just giving women oral contraceptives, which will supersede any of the effects of her own hormones, just like take charge of the whole hormonal milieu within her body. And we can also give her selective serotonin reuptake inhibitor drugs that'll keep the serotonin levels higher and voila, everything's going to be fine. So using this combination of antidepressant drugs, these selective serotonin reuptake inhibitors like Prozac, and oral contraceptives, and sometimes adding in non-steroidal anti-inflammatory drugs if there's pain and inflammation, and diuretics to get rid of the started chasing the symptoms around, not really getting to the underlying problem that caused it. So it's just trying to suppress the symptoms, if you will. But because these drugs can have adverse side effects if they're used month after month after month, a lot of women usually like to go off of these solutions at some point. And they really are looking for, if they can find it, natural approaches to manage PMS that have been shown to be effective. And this is where you can come in, because if you understand the evidence-based approach to it, then, for a lot of women, it's extremely helpful. So first we look, it's this imbalance between estrogen and progesterone. That's what the studies show, where you have elevated estrogen and too little progesterone in the second half of the menstrual cycle, especially the 5 to 10 days prior to menstruation. So this can arise from excess estrogen synthesis, too much estrogen synthesis, and also exposure to xenoestrogens in the environment. And we'll look at that later. But usually, often a woman is making too much estrogen and detoxifying it in a timely fashion through liver detoxification enzymes, and or when she goes to secrete it through the intestinal tract, it's the fecal route, it gets deconjugated and gets reabsorbed back into the body. We'll look at that as well. And also a reduced secretion of progesterone from the corpus luteum. A combination of these factors is what tends to lead to the high estrogen to low progesterone ratio. So it's typically estrogen excess and a mild progesterone deficiency that creates that imbalance. So we'll look at how we can solve it, but appreciate the fact that estrogen dominant environment is what leads to, and we'll look at the mechanisms through which it happens, with bloating and weight gain, and some of the mental neurotransmitter issues, depression and fatigue, migraine headaches as well, dysmenorrhea. These are all estrogen dominant issues that increase propensity for fibrocystic disease, as breast cells the glandular cells are dividing at a faster rate from too much estrogen stimulation, and of course the mood swings. So what happens exactly when you have this elevated estrogen to progesterone ratio? First, you get a decline in brain endorphin levels, which is responsible partly for the mood swings seen in PMS and some of the decreased psychological well-being. But also, elevated estrogen also tends to deplete the body of vitamin B6, which is required to make certain neurotransmitters like serotonin, which then feeds into that sort of depression cycle as well. And if women are using birth control pills or oral contraceptives to manage PMS, or even just to prevent contraception, then it depletes vitamin B6 due to increased turnover, which can also lead to decreased neurotransmitter synthesis, as I'm going to show you. So, but at the same time, vitamin B6 supplementation has been shown to improve symptoms of PMS. I'll show you a bunch of the studies. Excess estrogen may also give rise to elevated prolactin hormone, which is implicated in breast pain and fibrocystic breast disease. So this high estrogen dominance is factoring into neurotransmitter synthesis, too much prolactin. And here's where you actually see where vitamin B6 plays a role. So to make serotonin, which is the mood elevating neurotransmitter, you need vitamin B6, but notice you also need magnesium and folic acid and calcium and iron. You'll see that some of these play a role as well. And to go from 5-hydroxytryptophan to serotonin, you also need B6. Well, B6 is often deficient in a high estrogen state. The same with the catecholamines. To make dopamine, which, sort of is a reward type of, and a feel-good type of neurotransmitter, you need vitamin B6. And so if you're not making sufficient dopamine and serotonin, then you get into this situation where, there's mood swings and just a feeling of not having, an optimistic sense about yourself. And it can lead to more serious depression if there's other environmental or genetic susceptibility. Remember that oral contraceptives further deplete vitamin B6 from the body. Elevated estrogen also increases aldosterone secretion, which then retains sodium, and you get a lot of the swelling and bloating that women complain of, not just gut in the abdominal area, but their fingers and their ankles as well. So the elevated estrogen to progesterone ratio has been shown to alter endorphins, neurotransmitters, prolactin, aldosterone, which contribute to many of the psychological and physical symptoms of PMS. So these cyclic fluctuations that are sort of in the background have been are certainly create the biological susceptibility. But studies have shown that women who have PMS tend to have lower whole blood serotonin concentration. They're not making serotonin to the same degree. And a lot of this is based on sort of nutritional deficiencies that can be corrected. Reduced serotonin neurotransmission has also been linked, of course, to depressed mood, irritability, anger, aggression, poor control of impulses. And also, this is where we think some of the increased craving for carbohydrate foods and chocolate might come from as well. Some women actually then respond to selective serotonin reuptake inhibitors. If you can raise serotonin, a lot of this is going to be resolved, but a lot of women don't want to resort to Prozac to manage PMS if it can be done without drugs. And other neurotransmitters also get into the act. It's not just about serotonin, but also I showed you earlier that dopamine can't be synthesized without vitamin B6 and other nutrients. So that's one of the catecholamines, right? Dopamine, norepinephrine, and epinephrine. If you can't make dopamine, you can't make norepinephrine and epinephrine because they're the downstream neurotransmitters. And also gamma aminobutyric acid. All of these nutrients, to make GABA as well, you also need vitamin B6. You see, as you convert glutamine to gamma aminobutyric acid, you also need B6 here. So B6 is one of those underlying marginal deficiencies that is associated with PMS. So in recent years, mainstream practitioners have acknowledged that various nutrient deficiencies and dietary patterns may play a central role in the cause of menstrual discomfort. The mainstream literature now cites deficiencies in calcium, magnesium, manganese, certain B vitamins, vitamin E, and certain essential fatty acids that are linked to PMS. And they're exactly right in this assessment that they finally have come to in terms of reaching this obvious conclusion. Certain things are a factor. A high sugar diet, having a lot of caffeinated beverages and alcohol, they all have been shown to contribute to PMS, largely because they tend to promote inflammation and they spur on more proliferation. So cells divide at a faster rate, which can lead to breast tenderness and fibrocystic breast disease. And also, if you have uterine fibroids, it can make it worse. But the inflammatory component of these foods, we think, is the main culprit. In this regard, a number of clinical studies have shown that certain nutrition and supplementation interventions can be effective in the management of PMS and should be considered in the overall treatment plan. So how do we address it? Well, correcting the estrogen progesterone imbalance naturally. How do you do it? Well, a number of dietary and lifestyle and supplementation practices have been shown to improve the estrogen to progesterone ratio and provide relief for women who suffer from PMS. First thing that I would address here is the amount of dietary fat and fiber that women are ingesting. When they switch to a lower animal fat diet and more fiber, it helps to reduce circulating estrogen levels. So vegetarian women are known to have higher intakes of fiber, and they excrete 2 to 3 times more estrogen in the feces, and they have 50% lower circulating estrogen levels than omnivores. A high-fat diet stimulates the increased secretion and synthesis of estrogen. When women have less animal fat, less saturated fat and trans fats and deep fried foods, and they increase their fiber intake. Fiber helps to flush estrogen out of the system more effectively. So once it's detoxified in the liver and goes through the biliary tract into the intestinal tract, a lot of fiber will help to make sure that that fiber gets excreted in fecal matter and doesn't get reabsorbed back into the body through the enterohepatic pathway. Some studies have shown that if a woman lower their fat intake from 40% to 25% of their calories, so in North America, the average fat intake is 35 to 40%. Lowering that to 25% has been shown, and increasing fiber from 12 to 40 grams a day. That 40 grams is a lot. But they reduced their estrogen levels by 36% just through dietary change. In fact, just going to a low-fat diet has been shown in many studies to relieve premenstrual syndrome. So as much as I promote different types of supplements, and we'll see some of them, this dietary change should be one of the main staples of dietary management of PMS. Also, women who exercise more tend to have less PMS frequency and severity. We know that with PMS, with exercise, you're moving blood through the body at a faster rate. More estrogen goes through the liver, so it's going to get detoxified at a faster rate. And also because exercise increases endorphin release, women tend to feel better overall. There's also specific dietary supplements that have been shown to actually improve the estrogen to progesterone ratio. And I'm going to show those to you now. The first one and the most important one, in my view, is black cohosh. It contains these triterpene and saponin compounds, but especially the triterpene glycosides, which not only act like a very weak estrogen in the body, so it competes with the body's more potent estrogens, but black cohosh is the only known substance that can increase a woman's progesterone synthesis. There are no drugs that do that. You can give women progesterone as a hormone, but to get her body to make more progesterone from the corpus luteum, the only thing that's ever been shown to do that is a standardized grade of black cohosh with the right amount of triterpene glycosides. Additionally, the triterpene glycosides, because they look sort of like estrogen, they can block estrogen from affecting breast tissue and the uterus and tone down a lot of the PMS symptoms by blocking the more potent estrogens from getting into the cells or to stimulate the receptors. So the studies show that women who take black cohosh supplementation at a dose of 40 to 80 milligrams twice daily, that's standardized to 2.5% triterpene glycoside content, that's been successful. Just getting black cohosh that's ground up and put into a bottle or as capsules doesn't do anything. You need to have the right yield of the medicinal ingredients, which are primarily the triterpene glycosides. In terms of, is black cohosh risky? A lot of studies show that black cohosh may actually help to reduce risk of breast cancer as well. All these experimental studies that were sort of summarized in 2019 showing the effects of black cohosh in its ability with human breast cancer cell lines to actually tone down the replication of breast cancer cells, encourage them to undergo apoptosis, program cell death, decrease the proliferation of those cells. And women who have been given tamoxifen, experimental studies show that tamoxifen given to breast cancer survivors who are estrogen receptor positive in terms of their phenotype of their breast cancer cells, that black cohosh actually enhances the therapeutic effect of tamoxifen. So a lot of women use black cohosh with tamoxifen because the tamoxifen can produce a lot of hot flashes and menstrual symptoms, or like menopausal symptoms. And if they take black cohosh with it, it tones down those symptoms. And so far, there's been no adverse effects of black cohosh stimulating the recurrence of breast cancer in this very high risk group of people. So black cohosh looks like a very, very safe supplement to use. Here you see some of the triterpene glycosides, the chemical structure. Notice how close they look to the body's own estrogens. So when you look at the body's estrogens, note that estradiol is the weakest estrogen the body makes, whereas estrone and estradiol are much more potent. The other thing, another supplement that's been shown to be helpful in managing PMS are soy isoflavones. They also tone down the effects of the body's estrogen. They too, they look like estrogen, so they can attach to estrogen receptors and block the overstimulation of the body's natural estrogens or the body's sort of native estrogens from stimulating breast cancer tissue. Plus soy isoflavones, although they are estrogenic in their effects, they attach to the beta estrogen receptors primarily, which then blocks the estrogenic effects on the cell. So they almost have more anti-estrogen properties, even though a lot of women think that it's going to overstimulate. It actually helps to block the overstimulation of tissues from too much estrogen. So it can partially block the entrance of estrogens into the body cell, and in doing so, stop the overstimulation of breast cells and uterine tissues, which also then has important implications for decreasing menstrual cramps. Also, soy isoflavones enhance estrogen detoxification by upregulating detoxification enzymes in the liver responsible for estrogen detoxification. And soy isoflavones also block the oversynthesis of estrone hormone in fat cells. So fat cells typically in the adrenal glands, the adrenal glands secrete androstenedione into the circulation. Some of that goes into the fat cells and into breast cells, where the aromatase enzyme converts androstenedione into estrone hormone, a very potent estrogen. And then it either affects the breast cell or fat cells release it into the bloodstream, which will then affect breast and uterine cells. But soy isoflavones block the aromatase enzyme, so you can't make as much estrone hormone in the very first place. So it's not a surprise that women who are getting 45 to 75 milligrams of soy isoflavones per day tend to have better outcomes, and they report much fewer of these sort of estrogen progesterone imbalance problems, including having better menstrual cycle regulation. So you see the isoflavones, what they look like here, compared to, look at estradiol over there. So you can see how it can fit right into the receptors, block certain enzymes that are designed to receive certain estrogen precursors, and block those effects to tone down the effects of estrogen on breast tissue and other reproductive tissue. And then right in breast cells itself, these androgens like androstenedione that come out of the bloodstream into the breast cell normally would become estrone hormone, and from there they can become estradiol. Well, soy isoflavones block the aromatase enzyme, but so do the indole-3 carbonyls from cruciferous vegetables. So does ground flaxseed, by the way, the enterolectone and enterodiol, all great supportive nutrients here. But to block the 17-beta hydroxysteroid dehydrogenase enzyme that converts estrone into estradiol, it's isoflavones that do that. Soy isoflavones also block this step. It's estradiol that has the most potent effect on overstimulating reproductive tissue. So soy isoflavones are really a spectacular food and intervention to be counting on. Here's where you can get soy isoflavones from different foods on just a routine basis throughout the course of the month. So the target is to get, I would say, above 50 milligrams a day on average. It doesn't have to be every day, but as long as over the course of a week, someone's getting 50 milligrams a day on average, you're getting into a range that's strongly associated with fewer estrogen dominant problems, including menstrual irregulations. Then you also have irregularities. Also remember that as much as estrogen can affect estrogen receptors, the xenoestrogens from the environment can also have these unintended consequences where they bind to estrogen receptors and produce unintended signals that can also overstimulate estrogenic influences on breast and uterine tissue and other tissues as well, including neurotransmitter disruption. So where do we find all these xenoestrogens? Well, they're all over the place. They're in skincare products, they're in industrial products and plastics, they're in certain foods, they're in building materials, they're in insecticides. It's almost impossible to totally avoid this now with all the different chemicals that are out there that have these xenoestrogen type effects. So what you want to do is be able to detoxify them as effectively as possible, which we will talk about. So when we look at liver detoxification, it's a big story, but what you want to understand is that certain things like different hormones like estrogen and xenoestrogens, they first go through phase 1 detoxification, they form an intermediate, then they go through phase 2 detoxification, where they're going to get excreted. In the case of estrogen, it's going to go through the fecal route here. So what's important to estrogen metabolism are soy isoflavones, and you'll see them here, they're under flavonoids, and also the indole-3 carbonyl, which you see under cruciferous vegetables. They are important for phase 1 detoxification, especially with respect to estrogen metabolism. Then in phase 2 metabolism, most estrogen is detoxified either through methylation reactions or through glucuronidation reactions. The methylation reactions require folic acid, vitamin B12, magnesium, and choline or betaine. The body can make betaine from choline. And that tremendously helps with detoxification of estrogen, those nutrients combine. With respect to glucuronidation, that happens pretty easily. The problem is that as the estrogen gets into the intestinal tract, when you get into the large intestine, if you have a lot of unfriendly bacteria there, they can deconjugate, they can remove the estrogen from the glucuronic acid, and the estrogen can get reabsorbed back into the bloodstream. So what's been shown to help prevent that are prebiotics and probiotics, and also the ingestion of wheat bran fiber, as we'll see towards the end of the session. So these nutrients combine to improve estrogen detoxification, not only estrogen, but xenoestrogens as well. Soy isoflavones, indole-3 carbanols from cruciferous vegetables, the right amount of certain B vitamins, especially folic acid and B12, magnesium, and choline. And also prebiotics and probiotics can be helpful to make sure you have the right friendly bacteria concentrations in the large intestine. Then we have gamma erosinol from rice bran oil, also been shown to have a lot of therapeutic effects in the human body as an antioxidant, has anti-inflammatory effects. It's a cholesterol-lowering drug in Japan, but it also has female hormonal balancing effects that we've seen, and some anti-cancer properties experimentally. So it's a very nice sort of synergistic nutrient to tag on to black cohosh and soy isoflavones, as I did when I put together Women's Hormonal Balance, which has been around for a long time, has helped a lot of women. So it is the standardized grade of black cohosh, the right dose of the standardized grade of triterpene glycosides, with soy extract at a standardized grade of yielding 20% isoflavone content, and gamma erosinol using the clinically effective 150 milligrams twice a day. So most women have some success managing PMS symptoms by taking 2 capsules of Women's Hormonal Balance supplement every day through the menstrual cycle, not just the last 5 or 10 days, but this has to be working throughout the whole 30-day period. About 80% of women report good success, and especially menopausal women going through menopause, but it has effects also for women who are suffering from PMS. And also women who have fibrocystic breast disease, uterine fibroids as well. It helps to tone down that overstimulation from estrogen. That's the reason. With respect to the indole-3 carbinol and estrogen detoxification, there have been some great articles recently, some great research showing that not only does it enhance estrogen detoxification, but it also converts estrogen into the type of estrone hormone in the body that is going to have less of an estrogenic effect, toning it down. So in other words, the indole-3 carbinol helps to convert estrogen into the 2-hydroxyestrone form versus the 16-hydroxyestrogen form. So evidence in humans has shown that very substantially. So if we look at the next slide, what you want to do when the body is detoxifying estrogen is to promote more of the good estrone hormone, which is the 2-hydroxyestrone, and less of the 16-hydroxyestrone. And indole-3 carbinol helps very much with that type of conversion. So you have less of a potent estrogen acting on the body as it goes through the circulation. There's other botanicals that have been shown to be helpful in the management of PMS because they also have phytoestrogens in them, like Angelica species, Don Quay, and red clover, the red clover isoflavones, and licorice root. The problem with these is that the coumarin, they have a very high coumarin content. And notice that the word coumarin sounds like Coumadin, the anticoagulant drug. So coumarins also have this strong anticoagulant effect that can lead to internal bleeding. That's why I don't like them. And coumarins, if you have a lot of coumarins circulating and you go out into the sun, you can get a very bad photosensitivity-induced dermatitis. So you get skin lesions. So I tend to discourage women from using supplements that contain these agents because of the risk of internal bleeding, especially if they're on any other type of anticoagulant, even an aspirin a day. And licorice contains glycerinic acid that can also raise blood pressure. So I try to move women away from these particular botanicals and move them towards black cohosh, soy isoflavones, and gamma erosinol to get the effect I want. And black cohosh also has this tremendous antispasmodic effect on uterine smooth muscle, helping to contain even dysmenorrhea. And you see there, you've seen these references as we go through. You're going to see all the references at the end of the presentation. There is an herb that's actually very good called chasteberry that if it's standardized to the right amount of agnosides, has been shown to be effective in PMS management as well. So I do like chasteberry as an additional supplement if necessary. But studies have shown that B vitamins, more than a dozen double-blind clinical trials suggest that vitamin B supplementation is useful in the treatment of PMS. It's a cofactor for estrogen detoxification. If you go back and look at that chart I just showed you, you'll see B6 is also important for detoxification. It's a cofactor, as we saw earlier, for neurotransmitter synthesis, for serotonin and dopamine, and thus also norepinephrine and epinephrine, because you need dopamine to make those. And it's also a cofactor to make anti-inflammatory prostaglandins. So even just a marginal deficit in B6 leads to problems. So a lot of studies have shown that it's effective. It works synergistically with other B vitamins like niacin, folic acid, B12, and vitamin B2. And so let me just go back quickly and just show you what we saw here earlier in the detoxification slide. You'll see a lot of these B vitamins show up here. Riboflavin, niacin, vitamin B6, folic acid, B12. So it's a whole host of B vitamins that are required for normal detoxification, some of which work with B6 in the detoxification of excess estrogen. So we're back to this slide. So a B50 complex, I wouldn't just give someone B6 on their own. I would give them a B50 complex because it has more of a comprehensive approach. Also, studies show that taking B6 with 400 milligrams of magnesium has been helpful in managing PMS as well. You might want to know that all the vitamin B6 enzymes, the decarboxylation enzymes that make serotonin and dopamine, that require B6, those same enzymes also require magnesium. So magnesium and B6 work very synergistically in the body. And then vitamin E, some double-blind studies have shown that 400 IUs of vitamin E is also helpful with certain PMS symptoms, probably because it's toning down the synthesis of inflammatory prostaglandins. And that plays a big role in a lot of those situations are those complaints that women have. Modulating prostaglandins and also somehow regulating the circulation of hormones in PMS and fibrocystic breast disease. No one's been able to show how vitamin E does that, but there's some evidence that vitamin E may help to control circulating levels of these female-based hormones. And then calcium supplementation has been shown to be helpful in some studies with certain symptoms. We're going to see that again at the end, so we'll talk about it later. And also, again, magnesium supplementation and its role of helping to raise neurotransmitter synthesis, working with B6 in making neurotransmitter synthesis. And some studies on manganese. I don't think you really need that much manganese. As long as you're taking a good multivitamin, you're getting some additional manganese. I don't think you need to go looking for additional manganese. So finally, in 2018, there was this Cochrane database systematic review. I've been looking at this research over many years and I put together a number of review papers on it. But in 2018, the Cochrane database did the same thing. And here's what they said. Deficiencies of certain vitamins and minerals, including vitamin B, that means a lot of the B vitamins, not just B6, vitamin D, calcium, magnesium, play a role in premenstrual syndrome. The hypothesis is based on high incidence of PMS in populations with low levels of these micronutrients. Magnesium is essential to make dopamine. A dopamine imbalance can affect mood and lead to overwhelming anxieties. Previous studies have reported decreased circulating magnesium concentrations during the luteal phase in women with PMS, suggesting that a magnesium deficiency is a common problem in the etiology of PMS. In the Nurses' Health study, they showed that women who have a higher intake of vitamin D and calcium tend to have lower PMS incidence. And previous studies have shown that calcium deficiency during the luteal phase among PMS sufferers is actually quite common. And same with vitamin D. So understand that calcium, one of the things that it does in the cells is that it often acts as a secondary messenger that can actually stimulate genes to actually produce certain gene products. So calcium is a very important secondary messenger, which may also directly affect the secretion of female hormones. In addition, the risk of developing PMS is lower in women with a high dietary intake of B vitamins compared to those who have low B vitamin intake. It's required, as we saw, for serotonin metabolism, A B vitamin deficiency can hinder serotonin production, which can result in mood disorder. So this is now the Cochrane database systematic review. So this is why I think that giving PMS sufferers a high potency multivitamin that contains all the nutrients important for estrogen detoxification, for neurotransmitter synthesis, enough calcium to make sure you're getting secondary messages, enough magnesium, all the things that we just talked about. That women's hormonal support product, along with Adëeva all-in-one multiple vitamin, they should really go hand in hand as part of the natural therapy for this condition. And of course, you've seen this multiple vitamin before, many of you. So it has 1,000 milligrams of C and 1,000 IUs of D. It has a B50 complex. Here's the 400 IUs of vitamin E, 500 milligrams of elemental calcium, and other antioxidants. All the new, just sort of, it's like 6 different products put into one bottle. So it's very cost effective and convenient for people to use. But what about essential fatty acids? There's also evidence that because essential fatty acids can help to make anti-inflammatory prostaglandins and anti-proliferative prostaglandins, they've been shown to play a role. So gamma-linolenic acid that you would get, say, from borage seed or even primrose oil has been shown to be helpful in certain cases of PMS, and some studies have shown that. More recently, in 2017, this study in psychosomatic obstetrics and gynecology, this placebo-controlled study of 95 women with premenstrual syndrome given 1,000 milligrams of fish oil a day versus placebo. After a number of months, they said the mean scores of physical and mental components of quality of life were significantly improved in the omega-3 supplement versus the placebo group. The treatment of premenstrual syndrome using omega-3 supplement reduced symptoms and ameliorated women's quality of life. So omega-3 fats having this effect on producing more of the prostaglandin series 3 prostaglandins and inhibiting the inflammatory prostaglandin series 2. So just to review quickly again what that looks like, you're probably familiar with this now, that if you have a lot of animal-based products, not only is it going to increase estrogen synthesis, but a lot of that arachidonic acid via cyclooxygenase produces these inflammatory prostaglandin series 2, eicosanoids that would make things worse. Whereas giving women fish oil, which contains EPA and DHA, the EPA can become prostaglandin series 3 via the same cyclooxygenase enzyme, which is anti-inflammatory, anti-proliferative. Remember that flaxseed oil, alpha-linolenic acid, helps to support EPA synthesis, and gamma-linolenic acid from borage seed oil in the presence of vitamins and minerals and antioxidants drives the pathway towards prostaglandin series 1, which is also anti-inflammatory. So again, here is gamma-linolenic acid becoming prostaglandin series 1, but it needs B vitamins and magnesium and antioxidants to actually enhance that pathway. Remember that eicosapentaenoic acid from fish oil and DHA from fish oil also form these resolvins, which are also very anti-inflammatory, including DHA, which produces the resolvins of the D series, which are very, very anti-inflammatory. So fish oil, flaxseed oil, and borage seed oil, which is Adëeva Nature's essential oils, is also a beautiful sort of main staple in the supplemental management of women that have PMS. Women's hormonal balance with the high potency multi and Nature's essential oils is really a large part of the solution in conjunction with some dietary modifications. What about probiotics and prebiotics and digestive enzymes? In the journal Menopause International in 2009, they reported the studies showing the value of using probiotics and prebiotics for women that have PMS, especially if they have gastrointestinal discomfort, bloating, diarrhea, constipation. That's where you start thinking more about probiotics and prebiotics. There's really no studies that have been reported on digestive enzymes, but my own personal experience with women who have these problems where there's gastrointestinal issues, very often digestive enzymes can be helpful. So in certain cases of PMS where you have these sort of gastrointestinal issues, or you think that the reabsorption of estrogen from deconjugation is an issue, Then giving women probiotics from a supplement, getting them to have more foods that have probiotic strains in them, like sauerkraut and kimchi and pickled turnips. You know, all these things make sense to me. And you could also give them prebiotics with digestive enzymes. So of course, Adeeva makes this product called Flora Essentials, which is a high potency, full spectrum blend of digestive enzymes, along with the prebiotics, fructooligosaccharides and inulin, which are the foods that the friendly bacteria eat. And when the friendly bacteria in the gut ingest them, they flourish like crazy and they crowd out the unfriendly bacteria. So a lot of gastrointestinal issues that sort of are sort of this benign origin, there's no organic pathology present, can be remedied through digestive enzymes and prebiotics, which, you know, for many women is a godsend, because a lot of women don't make enough digestive enzymes in the first place, more so than males. Also, chiropractic and acupuncture, wouldn't you know? So there's a number of small clinical trials that have demonstrated the combination of chiropractic manipulation and soft tissue therapy being effective in the management of PMS, especially, as you know already, if you're a chiropractor, with back pain and abdominal cramping and dysmenorrhea. This is where chiropractic and acupuncture can play a tremendous role. So here you see a multi-center prospective randomized placebo-controlled crossover trial involving 25 subjects diagnosed with PMS. And statistically significant improvement in PMS symptoms was noted in the group receiving adjustment to soft tissue therapy from a chiropractor. So here's how the study was performed. They had treatments 2 to 3 times a week prior to menstruation for 3 consecutive cycles. And the women that got the treatment showed much better outcomes in terms of back pain and cramping and well, those symptoms primarily. And here's a single case of dysmenorrhea that was helped with chiropractic treatment. And another study by Walsh, 54 subjects with diagnosed with PMS and 30 subjects with no diagnosed with PMS underwent complete chiropractic examination by one of 2 selected chiropractors, each with a minimum of 10 years experience. So these were qualified chiropractors, a lot of clinical experience. The PMS group was shown to have higher percentage of positive response for each of the 12 measured spinal dysfunction indices, except for range of motion of low back. What they showed ultimately was that on average, the women who had PMS symptoms had more spinal dysfunction problems. So the researchers concluded that a relatively high incidence of spinal dysfunction existed in PMS compared to non-PMS sufferers, which may suggest that spinal dysfunction could be a causative factor and that chiropractic manipulative therapy may offer an alternative therapeutic approach to PMS sufferers, and it certainly does. Some studies show that acupuncture can also be helpful with dysmenorrhea symptoms as well. So in summary, in many cases, PMS can be managed naturally through dietary modification, exercise, and targeted nutritional supplements. Some of the recurring abdominal cramps and pain and back pain is also responsive to chiropractic care and acupuncture. With respect to dietary and supplementation practices, these are the recommendations that I think you should make your PMS sufferers aware of. Get into eat less animal fat and deep fried foods and pan fried foods and trans fats, with the exception of fish, of course, which is high in omega-3 fats. That's a very strong strategy that's highly effective for a lot of women. Also encouraging to eat more fiber in vegetables and to include wheat bran fiber. Wheat bran fiber seems to be the fiber that helps with estrogen excretion to the greatest degree and helps to prevent its deconjugation in the large intestine, so less of it gets reabsorbed back into the body. Along with eating more cruciferous vegetables for detoxification and to synthesize the less potent types of estrogen, the 2-hydroxyestrone versus the 16-hydroxyestrone that I showed you, and also ground flaxseed, which also helps to block the conversion of androstenedione into estrone hormone. These things are valuable, as well as eating more soy products. Taking a high potency multiple vitamin for all the obvious reasons, to get the B vitamins, the vitamin E and magnesium and calcium and other antioxidants. Black cohosh at the dose that I showed you, soy extract at the dose and standardized grade that I showed you. More soy foods in the diet, especially if you're having soy foods instead of high-fat animal foods as a source of protein. It's a great substitute. You're getting a double benefit. You're getting less of the high animal fat foods, and you're also at the same time, you're getting soy, which has been shown to improve detoxification of estrogen and block the estrogen effects on the body. And, all the things that I showed you, blocking the aromatase enzyme. And then in addition to a high potency multivitamin, which is going to have, yes, the one I showed you, 500 milligrams of calcium and 200 milligrams of magnesium. Some women might need more than that. If your diet is really suboptimal in those nutrients, you might need to get them an additional supplement to get them a little more cal-mag, if you will. And then essential fatty acids, fish, borax seed, and flaxseed oil to make the anti-inflammatory prostaglandins 1 and 3. But that works a lot better if you have antioxidants and B vitamins and magnesium in your system at the dosages that you get from a high potency multivitamin. That's where the essential fatty acids, that's when they work the best. Also suggesting women eat more probiotic foods and maybe take a probiotic supplement. I think that's a good idea. They may need prebiotics and digestive enzymes as well, especially if there's gastrointestinal issues. You might want to add that on. Encouraging to do aerobic exercise on a regular basis and have their spine and pelvis checked by a doctor of chiropractic to see if there's spinal dysfunction problems. There usually, from personal experience, I can tell you there usually is. And correcting those problems and having some pressure on the sacrum can go a long way to alleviating symptoms. It's remarkable. And of course, the consideration of acupuncture as well. One last consideration is the role of stress in all of this, which often gets sort of put on the back burner, but it's important. Remember then that when someone's under chronic stress and it's really affecting them, that they're secreting more of the sort of corticotropin releasing hormone from their hypothalamus. That causes the pituitary to pump out more ACTH. The ACTH then tells the adrenal glands to secrete higher levels of cortisol and cortisone than is normal. And so what you're doing here is, as you form cortisol, here's the different routes to form cortisol, down through pregnenolone to cortisol, down through progesterone to cortisol. But as you're making more cortisol, you end up making less progesterone because more of it is being siphoned off to make cortisol. So you end up with lower progesterone levels. And it can also affect other hormones as well. So that hormonal imbalance can also occur when a woman is constantly under chronic stress during the pandemic. It's a stressful time. So the steroidal materials are being sort of siphoned off to make cortisol because ACTH is telling the adrenal glands to make more higher and higher levels. And so some studies have shown that this siphoning off to make more cortisol leaves women with lower progesterone levels and also changes the hormonal cascade right across the board that can lead to a lot of the other symptoms. So this is where adrenal adaptogen herbs can be helpful. So cortisol, look at the effects it's having on all the different tissues. It's causing muscle catabolism. It's going to cause the liver also to break down more glycogen. So often blood sugar rises. It can lead to prediabetes and diabetes. Also bone demineralization. Cortisol can also interfere with the ability of thyroid hormone to stimulate normal metabolism in certain cells. So a woman's metabolism slows down. Even though her thyroid hormone's normal, the cortisol is blocking the effects of thyroid hormone. So you get weight gain and other things, mood changes and skin changes. So keeping that cortisol level lower is important. So, mind, body, relaxation, exercise can help to bring it down. But ingesting adaptogen herbs can also be helpful, particularly ashwagandha, schisandra, and rhodiola. So I'm going to do a webinar just on adaptogen herbs as a separate webinar at some point down the road. There's some references here that you might want to refer to, though, in the meantime. But you should know that Adeeva makes a product called Adrenal Support Formula that has the dosages and standardized grade of rhodiola, ashwagandha, and schisandra at standardized grades that have been shown to be effective at bringing cortisol levels under control, even while the person is still under stress. I'll show you that research on another webinar. Along with other nutrients that help the adrenal glands actually make the nutrients that are required for adrenal hormones so that you don't run into an adrenal exhaustion situation. So sometimes where stress is a factor, even adrenal support becomes a consideration. So here's how I would map this out in my mind in terms of supplementation of PMS patients. I would use Adeeva's Woman's Hormonal Balance as a mainstay, along with the high potency multivitamin and nature's essential oils. Those three things, that combination addresses a lot of the underlying etiology that causes the whole array of PMS symptoms. If the abdominal symptoms continue and the person's using more probiotic foods and they're taking a probiotic, then they might want to consider Flora Essentials, which has digestive enzymes and prebiotics. And if stress is a factor, if it's obvious that stress is a factor, then you may want to add Adrenal Support formula. So again, other things that Adeeva doesn't make that are considerations here are probiotic supplements. I think that's a very worthwhile strategy. And also, if woman's hormonal balance doesn't contain the symptoms completely, then I would add chasteberry at the dose and standardized grade that I showed you on the previous slide. And we'll make these slides available to you because we really appreciate you sitting in. If you want to go back and click on the links and see the references. And speaking of references, as you'll notice, I put the references at the end of a lot of the bullet points. And here are the references that I'm referring to, all in sequence, that correspond to the numbers that are on the slides. So again, thank you for sitting in today. I greatly appreciate your attendance on this webinar. I hope that you found it helpful and useful. And if you have any questions, of course, you can email me at drjames@adeeva.com.